Tonight, in the Alfred Hospital's intensive care unit.
Open your eyes, Timothy.
Our worries would be that the pressure inside the head would get so tight that the blood supply to the brain would be cut off and the brain would die.
I'm not going to give up on him yet.
She's a 33-year-old woman with a past history of cystic fibrosis.
Putting the patient's blood back through the lung causes some inflammatory changes in the new lungs.
Being told your one and only child's going to pass away.
Damien is at a crossroad. The swine flu has definitely taken quite a hold.
He's a fighter. He won't give up.
This disease process could kill him.
The sickest patients, the most advanced technology, medical care second to none. It's always a matter of life or death. In the trauma pod of the ICU, 22-year-old Tim is in an induced coma after brain surgery. Tim's brain was severely injured when he was punched in the head at a party.
At the party, someone asked Tim to ask a group of people to move on, and he did. That's the sort of kid he is. He's finished up on the concrete, obviously with one hell of a blow. He knows I'm here, don't you? You know I'm here.
Our concerns from the intensive care are that he's had a lot of swelling in his brain, and we know he's got a fracture in the bone up the back of his head there. Because of that, he's had an operation to take away some of the bone at the front of his brain to allow the swelling to come out, to prevent the pressure inside his brain going up.
Surgeons have also inserted a tube to drain off the excess brain fluid. Even so, the pressure inside Tim's brain remains dangerously high.
We're at the point at which he's almost on just about everything we can throw at him in terms of treatment. If his pressure were to start to go up again, we would repeat the scan to have a look to see if there's any more swelling. We'd talk to the neurosurgeons about whether there's anything else they can do surgically. Our worries would be that the pressure inside the head would get so tight that the blood supply to the brain would be cut off and the brain would die.
The team has also lowered Tim's body temperature to 34 degrees. This slows down his metabolism.
There's not as much blood going in there, so the pressure inside his head comes down.
2 weeks ago, Tim moved in with his girlfriend, Mel. They were looking forward to their future together.
Some nurses say that he might do a full recovery, and then others say that he's pretty bad, and so you just have to juggle it and just hope for the best that he's going to get better and that he's going to be in my team again. Nearby, in an isolation cubicle, 26-year-old Damien is dangerously ill with swine flu.
Damien's come to intensive care because he's got a viral pneumonia, which we believe is due to influenza type A, H1N1. He presented to the Launceston Hospital in Tasmania, and he was so sick that he couldn't be managed in intensive care with a ventilator, and a request was made to the Alfred whether we could provide ECMO support.
A team from the Alfred flew to Tasmania with the ECMO machine and brought Damien back to the ICU. ECMO is a therapy of last resort for patients whose lungs don't work. The machine takes blood out of the body, fills it with oxygen and pumps it back in.
Anyone who gets onto ECMO really has life-threatening respiratory failure. What he's got is an acute, what we call an alveolitis, so it gets into the actual air sacs at the end of the lungs and it causes them to become inflamed and leaky.
You just take your time and you just relax, OK?
Back at the Launceston General, they gave him a few hours.
Sorry? They gave him a few hours to live?
Then they said there's no more we can do for him. We have to rush him to Melbourne, and here we are. You're in good hands, I promise you.
ECMO for him at the moment was a life-saving therapy, without doubt. It now buys time for him to get himself better with the help of our antibiotics, antivirals, and hopefully not run into any problems while he's on the ECMO machine.
The ICU team has done everything it can. Only time will tell if Damien can pull through. a young woman has arrived in the Alfred's ICU after life-saving surgery.
We just need to start the insulin back up again, okay?
This morning we've had Samantha come into us with a past history of cystic fibrosis, which is a chronic congenital lung disorder which causes severe dysfunction of the lungs and infection, very nasty infections in the lung.
Cystic fibrosis, or CF, creates mucus that clogs up the lungs, and people with the condition need daily physiotherapy to clear the mucus just so they can breathe.
She's been doing about 5.5 hours of physiotherapy every day to clear the mucus off her lungs.
Doing the physio means she has to cough up, and if she doesn't, it's like she drowns in her own mucus.
In the past, many CF sufferers didn't live long.
Being told your one and only child's going to pass away when she's a teenager, it was awful.
A few days ago, Samantha came down with a life-threatening lung infection and was admitted to the Alfred. And that's when she got her lucky break.
A donor came up that was a match for her, and we were able to give her a very good set of lungs. She tolerated the procedure very well, and the operation from a technical viewpoint went very smoothly.
She's working out really well, and the most thing she's been complaining about is the tube. Yeah, she wants that out. The tube's bothering her the most. There's no pain across her chest.
But with any lung transplant, things can and do go wrong.
We get what we call a reperfusion injury, which is where putting the patient's blood back through the lung causes some inflammatory changes in the new lungs, and they become very leaky and filled with fluid. Her main issue now over the next few days and weeks is going to be managing her immunosuppression so that her body doesn't reject the lungs, as well as recovering from what is a pretty big operation.
Tim has been in the Alfred's ICU for 3 days now after he was king hit at a party. His neurosurgeon, Professor Jeffrey Rosenfeld, brings the family in for an update.
There's a lot of swelling in his brain, and one of the reasons why there's more swelling than we expect is that vein's blocked at the back of his head due to the fracture in the skull. Eventually the pressure will go down, but if it goes up, despite all of what we're giving him, we might have to go in and let the pressure down surgically, which means that we'd have to take some more of the brain out at the front.
If you take this brain bit out, you won't know how that affects him until he wakes up.
Correct. But, you know, that part of the brain can be removed and the person can make a very good recovery.
Yeah.
You wouldn't know they've had that bit taken out.
Even so, the idea of removing part of Tim's brain is a scary prospect.
Just the not knowing whether he's still going to be the same person when he comes out.
Four days after arriving in the Alfred's ICU with swine flu, Damien is still in isolation and critically ill.
More adrenaline.
And just wanted to not have.
Last day we can.
Unfortunately, his lungs haven't not yet responded to the treatment, and the swine flu has definitely taken quite a hold. The ECMO circuitry that we're supporting him on currently for his lungs or his breathing is doing its job, but we're sort of in a static level at the moment where he's not getting any worse, but his lungs certainly aren't getting any better with the treatment we're providing.
Keep it where it is and then watch the numbers.
Sure.
While he's so sick and still and lying in bed and big tubes in his body, he's at very much risk of infection, and infection on its own could cause issues which could be a threat to his life.
Damien and his partner Christine have a young family back in Tasmania, and Christine is adamant they'll soon be together again.
He's coming home. He's a fighter. He won't give up. He just needs to sleep and relax and let the machines do it.
But the machines alone can't save Damien. His body needs to rally and needs to do it fast.
Definitely Damien is at a crossroad at the moment. He needs to respond to the medications that we're giving him to treat the swine flu, and also the level of ventilation we're giving him. We're very concerned at this stage. If he were to deteriorate further, this disease process could kill him.
In the cardiothoracic pod, Samantha is exceeding all expectations after her lung transplant.
Always doing best to make donor proud. Absolutely. Well done.
Now, the team has to remove the breathing tube and get her breathing on her own.
Bit nervous? You'll breathe. It'll be fine. What we'll do is when we take the tube out, I'll suction as we're pulling the tube out, so we just get any sort of spit that's sitting around that cuff.
It's a big step for Samantha. Without the breathing tube, she has to trust her new lungs will work.
Oh,
All right, it's okay, sweetie. Just cough. Come. Cough, 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 cough. Well done.
Some people don't have this happen for days after the transplant, and for her to have it within hours is just fantastic.
I feel better, sweetheart.
Kind of emotional.
Yeah.
These lungs I have.
Samantha's new lungs appear to be working well, but they're still vulnerable to infection and rejection. She will need to be closely monitored.
So Tim, how did he go overnight?
Stable overnight. ICPs have been maintained.
It's day 5 for Tim in the trauma pod, and he's looking slightly better.
Tim's had a pretty good last 24 hours, in as much as we've got control of his intracranial pressure, the brain swelling, really. He's, with the therapies that we've been giving, the thiopentone, a drug that keeps him unconscious, and the hypothermia, cooling his body, we seem to have just got control, whereas about 48 hours ago we really didn't. Tim, open your eyes for me. Open your eyes, Timothy. It's hard to tell.
Can't see anything.
Maybe.
Oh, little one.
Maybe on that side, but yeah, they're both hard to see reaction, but they're small. He's 34 degrees. I guess we can gently start to warm him up and see what happens.
Despite this first sign of improvement, no one can be sure if Tim's brain will ever fully recover.
We're also nervous about what his long-term outcome might be as well. And because although we've got control of the pressure, that doesn't tell us anything about what his underlying brain function might be as well.
It's day 6 for Damien in the isolation cubicle with swine flu, and he's definitely turned the corner.
We don't need to have him on the ECMO circuit anymore, the external oxygenation. His lungs are doing all the work, and our plan is to get all those big tubes out today and let him slowly get better.
But Damien's medication could complicate the procedure.
He's on heparin, which thins the blood. So he's on the heparin now to enable him to be able to go through the external circuit. So we have to turn the heparin off, hope that his clotting returns to normal, and then we pull out very big cannulae. There's a real risk of bleeding.
Okay, let's clamp.
You ready?
Yep.
Arm clamp. Okay, it's off. Beautiful.
So we've just taken out those 2 big lines that go into the veins. So we just have to press and hold until the veins close themselves off, probably for about 20 minutes.
The technique works, and Damien's veins close off. But an hour later, the alarm sounds. And the ICU team comes running.
Don't push hard, just push up. Just have a look, find the exact spot with one finger. So do it on each side, one finger.
He's coughed. And when you cough, you increase your pressure in your tummy. And increasing the pressure in the belly has just caused some oozing from the sites.
Yeah, then the trick is not to do that and block the whole leg. Pause. Ready? Yeah, here it comes. Coming.
Is that getting under control or don't know?
Not sure.
It's been very minimal blood loss. All we've had to do is go back in and put a little bit more pressure on. But at the time, of course, when he coughed, it was uncertain how much he was going to bleed, and that's why the emergency buzzer was pushed to get all the staff in there as quickly as possible and avert any further bleeding.
Getting Damien off ECMO has been a huge step. Now there's every reason to hope he can recover from the deadly virus. In the cardiothoracic pod of the ICU, Samantha is making a textbook recovery.
There we go, sweetheart. Very determined girl. Yeah.
I know I wouldn't have had much longer, especially the last 6 months. I was really feeling more and more breathless walking around that, yeah. That's when you think, gee, I'm dying now. now I've got my life back, and to be able to breathe is fantastic, and for someone to have been able to give me that opportunity, it's just wonderful, and I hope everyone considers organ donation.
On your mark.
Incredibly,
Set.
only 10 weeks later, Samantha is running in the Cystic Fibrosis Marathon.
Didn't think I'd be this strong at all for it. I was hoping I would be, but realistically I didn't think it would happen. But it's just fantastic not coughing all the time as well, because it used to wear me out so much, and yeah, eating a lot more and everything like that. It's feeling kind of normal now.
When you suction him, does he do anything? Does he cough?
No.
Not at all.
It's 6 days since Tim arrived in the ICU, and in the past 24 hours, he's gone downhill.
Pressures in his head have increased overnight. They were up and down yesterday and the day before. However, overnight and this morning, they've remained up.
Very concerning. You just stare at the little numbers and you see it go up, and it gets pretty hard, but you beg him to stop and put the pressures back down.
Tim's decline has the team worried.
Okay, back out. 1, 2, 3.
He'd had a little bit of more frequent venting, as we call it, from his drain that's in his brain. And that seems to have been a combination of two things. His body's been getting slightly warmer, as was our intent, but he seems to be sort of developing a fever as well, or perhaps an infection that's underlying it and causing the temperature to rise. So we had to do two things. One was to give him some treatments to try and reduce the pressure in his brain, things like extra salty water, and we've also cooled down his body a little bit. So the other thing we thought we'd do in his head now is a CT scan, another brain scan.
The CAT scan allows doctors to see what's going on inside Tim's head.
The surgeons removed some blood that was sitting just in this part of the brain. One of the reasons we did the CAT scan was to make sure this didn't reaccumulate inside this portion of the brain, and there's no evidence to suggest there's any new blood there at the moment. This is someone who should have a grey brain throughout, and it's got swelling, it's got hemorrhage, it's got air, it's got skull bone that's missing, and it's got the midline shift, as we call it. And these are all features of a very severe brain injury, and just tells us how horrific the punch that he got was.
It's a terribly grim picture, but his partner Mel still believes Tim can recover.
He would stay strong for me, and he would be here to support me, so I'm not going to give up on him yet. "24 hours after swine flu patient Damien was taken off ECMO, his partner Christine finally gets the news she's been waiting for.
The result came back negative from infection control, so we are ready to take Damien out of isolation.
Did you hear that? We can take these masks off now. Can I rip it off? Look at that. We're safe.
His chest X-ray is looking a whole lot better. The agent that was causing the inflammation has now been cleared, so now the natural repair processes are in place. So we're seeing nice aeration of the bottom of the right lung in particular, and much better clarity throughout the left lung. At this stage, he's looking like he's made an excellent recovery over the last 2 days, so he'll continue to do well.
Even so, the swine flu has taken a heavy toll on Damien's body.
He will have lost a lot of muscle tone, and it will take quite some time to feel that he's got his strength back. In fact, some patients who go through this severity of illness will actually say it takes them a full year to feel back to where they would normally be, even though they were young and fit to start off with.
First thing I want to do is, when I get home, is give the kids a big cuddle and a kiss. Yeah, I miss them heaps.
2 weeks after coming to the Alfred's intensive care unit, Damien is heading back to Launceston.
Oh, look. Thank you.
You're welcome.
And he's in for a big surprise when he gets there.
I'm going to get down on my knee and propose marriage to him. I'm hoping he says yes to me after everything I've been through.
Tim's been lying in a coma now for 2 weeks.
Now I've got some good news for you.
But today, there's great excitement in his cubicle.
Okay. Are you ready?
Yep.
All right. Tim,
open your eyes up for me. Tim, open your eyes, really as wide as you can.
You can.
Yeah.
Great, Tim.
And I'm going to put a little bit of pressure on his finger. Push away. That's it, well done.
We knew you were done, didn't we?
I know, it's a big relief, isn't it? I told them they'll surprise everyone.
I'll get to see what
Doesn't surprise us, Mel, does he?
Nah.
Great.
Started withdrawing.
Really?
Yes.
Tim, I'll just have a look at your eyes,
Andrew's
mate.
going to have a look at the eyes, darling.
Good morning. Tim, can you look this way? Okay, it's a very small thing.
Yeah.
But it's a start. It's a start. We'll get the sedation off and assuming the pressure around the brain stays stable, and then we'll have a clearer idea of where we go from there.
We just cried tears of happiness today instead of tears of sadness, so it's good.
It's been a great day for Tim's family, but it's far too early for doctors to say if Tim will ever be the man he once was. Next time in the Alfred Hospital's ICU, Tim has a long road ahead.
Yeah, you squeeze it, darling. You squeeze it very hard, mate.
This is the direct result from alcohol fuel violence. It should never, ever have happened.
The nerve to the voice box was spread over the tumour.
It was growing that rapidly that it would just block her airways and she'd die. Simple as that.
After his transplant, he was fine on his feet, doing everything, and now all of a sudden he's back in hospital.
The day he came in, I thought he was probably going to die that night.